Hi class, let's talk about a highlight disease, pharyngitis. The pharyngitis, or the term pharyngitis, refers to inflammation of the pharynx, or inflammation of the back of the throat. Obviously, this is going to have some pain or inflammation associated with it, with that itis at the end of that term. So the back of the throat, if somebody opens up their mouth and goes, ah, and sticks out their tongue, you may want to use a tongue depressor, maybe not. You'll notice that there's going to be a reddened or swollen mucosa in their oral pharynx region. If their tonsils are still present, those tonsils will oftentimes be swollen, and there'll be some nasty or foul-smelling breath from the high bacterial concentrations, if it's from a bacterial source. Pharyngitis can be caused by bacterial or viral sources. If it's caused specifically by a streptococcal-based disease, there are also going to be some white pockets or white patches that are going to be invisible on the walls of our throat. Sore throats that are caused by bacteria, generally speaking, are much more painful than those that are caused by virus, and are typically going to have that fever, headache, and nausea associated with them. Virally based pharyngitis is not as severe, and we're not going to spend very much time talking about it. So here is the back of the throat. Notice how it is nice and red here in the uvula. We can see the mucous membrane back here in the oral pharynx region. It's highly reddened. We can see some white patches on the walls of the throat and by the tonsils. So this is absolutely going to be exhibiting the classic symptoms of a Streptococcus-based pharyngitis infection. The same viruses that can cause the common cold are also capable of causing pharyngitis. Typically, those viruses or viral-based pharyngitis isn't going to be as severe. Another mild form of pharyngitis could be yelling a lot. If you spend a lot of time yelling, or if there's lots of drainage coming from your sinus cavity, that could potentially cause pharyngitis. The two forms of pharyngitis that we're going to focus on or talk about in detail are pharyngitis caused by Streptococcus pyogenes and Fusobacterium necrophorum. So first, let's focus on pharyngitis formed by or caused by Fusobacterium necrophorum. This bacterium causes pharyngitis in between 10 to 30% of all incidences that occur in adolescents, teenagers, and young adults. So it's fairly common. It's significant. This bacterium is capable of invading the bloodstream and causing Lemaire's syndrome. Sometimes, if we perform the classic strep screening, we can miss this infection. This bacterium, thankfully, is sensitive to penicillin, but notably, it's not sensitive to erythromycin. If there's a choice, clindamycin is the first choice, and unfortunately, there's no rapid test available for this bacterium, unlike with the strep bacterium. So let's spend most of our time focusing on pharyngitis caused by Streptococcus pyogenes. Streptococcus pyogenes is a gram-positive coccus. It's going to grow in chains. Strept is a prefix that means chain. Coccus means spherical. So we're going to have chains of spherical bacterium. Because it's a Streptococcus bacterium, it's not going to be a streptococcal genus. It's not going to be associated with endospore formation. If we look at our bacilli bacterium, those bacilli are classically associated with the formation of endospores. This species of bacterium is non-motile. It doesn't have flagella or cilia to help propel it. It does not form capsules, thank goodness. That means it's fairly easily phagocytized. And it's also going to be a facultative anaerobe, which means that it can live in low oxygen and no oxygen environments. It's capable of fermenting a wide variety of sugars, which means it's able to derive nutrients or use a wide variety of foodstuffs as its carbon source. To help diagnose this bacterium, it's notable that it does not produce catalase. Since it does not make catalase, the addition of hydrogen peroxide will not equal bubbling with the simple catalase test. However, it does have peroxidase, and that peroxidase system that it does have allows for it to survive in the presence of oxygen. So it's missing some of the enzymes that are classically associated with oxygen tolerance but it does have a few. If we look at the pathogenesis of Streptococcus pyogenes, if we leave it untreated, it can result in some very serious complications, such as scarlet fever. If that Streptococcus pyogenes infection continues to progress, eventually there'll be enough Streptococcus pyogenes that we can start to have viruses targeting the Streptococcus pyogenes, so bacteriophages. And those bacteriophages can mutate the Streptococcus pyogenes so that it can start to make a erythrogenic toxin, a toxin that targets our red blood cells. This toxin will cause a sandpaper-like rash to occur on patients and has a fairly high fatality rate. And by fairly high, I mean really high, at 95%. Another potential complication of Streptococcus pyogenes being untreated is rheumatic fever. As that name implies, rheumatic fever is going to be associated with rheumatoid arthritis type symptoms, and it's due to the immunologic crossover that occurs when the streptococcal M proteins and the heart muscle become confused by our immune system. Oh, there we go. If we look at typical viruses that can cause Streptococcus pyogenes, excuse me, this is a typical Streptococcus pyogenes bacterium. This bacterium is going to have a nucleoid region in the center that contains its DNA. And if we look at it, it has M proteins on its surface, in addition to hyaluronic acid, lipoic acid, lipoteichoic acid. And these particular acids and molecules on the surface of Streptococcus pyogenes make it particularly virulent and pathogenic. Streptococcus pyogenes is also capable of secreting extracellular toxins. In particular, streptolysin O and streptolysin S. These two particular extracellular toxins can cause beta hemolysis in sheep blood agar. So it can be used as a diagnostic tool, or based off of the lysis, or how the blood lyses within that sheep blood agar, we can determine whether or not we're working with Streptococcus pyogenes or a different species of Streptococcus. That erythrogenic toxin can cause that bright red rash. It's going to that's associated with scarlet fever. It induces fever in the patient, and only lysogenic strains of Streptococcus pyogenes are going to make that erythrogenic toxin. And those strains of Streptococcus pyogenes that make this toxin typically are going to need to be conjugated with a temperate bacteriophage to initiate synthesis of the erythrogenic toxin. Approximately 1/3 of all sore throats have been caused or are caused by Streptococcus pyogenes. So it's quite common. We can transmit Streptococcus pyogenes via respiratory droplets or coughing or direct contact with mucus secretions. So picking up dirty Kleenexes would be a good example of transmitting that disease. Streptococcus pyogenes is normal biota in approximately 15% of the population. So we have 15% of the population being an asymptomatic carrier for this microbe. If we look at Streptococcus pyogenes, there are over 80 different serotypes, or 80 different subspecies, so to speak. And because our specific immune system is so specific, we have to be exposed to a specific strain or subspecies of Streptococcus pyogenes until we can develop, or in order to develop immunity for that specific subspecies. So much like the common cold, because there are so many different kinds of Streptococcus pyogenes, there are going to be individuals that are going to endure multiple bouts of pharyngitis. We do have rapid diagnostic tests to help quickly determine if we have Streptococcus pyogenes causing the pharyngitis or a different pathogen. They are going to rely on the pharyngeal swab, and we'll use antibodies within this test to detect the presence of group A streptococci. This particular test has a high rate of false negatives, so it's going to require a follow-up culture to confirm the diagnosis. If we are trying to culture anything from a pharyngeal swab, we're going to plate it on sheep blood agar. That Streptococcus pyogenes forms beta hemolyzed blood as opposed to alpha or gamma hemolyzed blood. So this is going to help us to distinguish the Streptococci species that have beta hemolytic groups from other streptococcal species or enterococci. We also can perform a bacitracin test, disc test as well, but that is not as commonly done. Generally speaking, there is no prevention and there is no vaccine for Streptococcus pyogenes. We can help reduce the amount of transmission by practicing good oral hygiene, but this will only reduce, not prevent the transmission. So we can wash our hands. If we cough, we can cough in our elbows, and we should also sterilize, or excuse me, we should degerminate our hands before we serve food and before eating food. If we're looking to treat a case of Streptococcus pyogenes, generally speaking, it's going to be treated with penicillin. If the patient is allergic to penicillin, then we can use cephalexin. And if we are using antibiotics to treat this disease, sometimes we'll use some secondary antibiotic treatments to prevent the serious sequelae or serious complications associated with this disease, such as rheumatic fever or scarlet fever. So we talked about pharyngitis. Pharyngitis can be caused by a virus. Generally speaking, to diagnose a viral cause of pharyngitis, we've ruled out Streptococcus pyogenes, and we typically say, okay, it's not Streptococcus, therefore it's probably a virus. Let's just let you get better on your own. If it's Streptococcus pyogenes, we can plate it on blood agar to help confirm the diagnosis, or we can use a rapid test. And if it's Fusobacterium necrophorum, we should grow that in an anaerobic agar, probably within an anaerobic growth chamber as well, to help eliminate or reduce the amount of oxygen present. If we look at prevalence, approximately 20 to 30% of all cases of pharyngitis are from Streptococcus pyogenes, 10 to 30 are from Fusobacterium necrophorum, and then most cases, 40 to 60% of pharyngitis are viral in nature. If you have any questions for me about this presentation or this material, please feel free to post them in the discussion board or shoot me an email. Happy studies!